day, and you know me, I cram in a lot of information, but because it's pranayama, as I was saying a little bit earlier, before you ever practice a pranayama technique, you must know the indications, the cautions, the contraindications. And it is up to you in this class or people watching at home or in future recordings. You are responsible for knowing your indications, cautions, contraindications. We are learning the techniques. At no point in this class do you have to perform them, okay? If you know you have a contraindication, then don't do it. If you get dizzy, stop, rest. Don't do that one anymore. If you start feeling weird, funky, emotional, headachy, strange, stop. Don't do it anymore. Whenever we're doing pranayama, we always want to start off basic and small and then work up to it. You know, when I do pranayama practice, I bring my breaths to 1 breath per minute. I don't want anybody else doing that until they've spent months or years practicing that, because you can have extreme medical reactions. So you are responsible for your own breathing, okay? And we will go through many different pranayama types, what they're used for. Do they affect our doshic system through Ayurveda, Vata, Pitta, Kapha? Are there indications for how to control or change our Ayurvedic doshas? Are there indications for each breath on whether or not they help reduce or treat or change our balance of Ayurvedic mind gunas? So we've learned about tamas, which is that slow, lethargic mind area when it's out of balance. And we've talked in other classes about rajas. Well, rajas is good and active, but when it's really high, there's breath techniques to balance that. I'll talk about each breath technique in regards to what does it help reduce or treat in regards to OCD, obsessive compulsive disorders, anxiety, depression, fear, pain, sleeplessness, anxiety, as long as we all know in the class that we are not learning this. Not all of us are going to be able to treat people with the breath techniques. Many of you in the room are medical providers with licenses to do so. You're fine. This is an excellent class. But all of you for yoga teacher training or whatever else that you're going to do in life, board meetings, etc., wherever you're at, always make sure before you offer, suggest, teach, or recommend a breath technique that you know the indications, the cautions, and the contraindications. Hugely important. I've been to classes before where the teacher was like, all right, now we're going to do breath of fire for the next 15 minutes, and I've seen somebody have a seizure, and we've had to call 911. I was like, well, isn't that a bummer? Right? You know, wasn't my class. And prior to suggesting and beginning the breath work, nobody in the class was asked about medical conditions. Nobody was cautioned. Nobody was given a tap out. If you get to, it was more like this, go, keep going, everybody keep going. And I was like, we're going to have a problem. Seizure. I was like, I knew it. I've been to other classes where there was literally 100 people. And And there was not one asking, suggesting, if it's too much, stop. It was go, go, go. Never teach pranayama that way, ever. Never do pranayama that way, ever. Okay? You can kill somebody. You can kill somebody with inappropriate pranayama. And, you know, I'm an emergency room worker, and I don't say that lightly. Pranayama needs to be taken seriously. Most of the time you're going to teach pranayama to somebody and it's just like, okay, let's all take a chill pill and relax. But there are certain techniques that can be dangerous. Okay? So let's take a look first at some basics about breathing. Okay? So the first thing we want to realize is that most people are completely unaware of their breathing. You get the privilege of breathing without having to think about it. You breathe in your sleep. You breathe while you're walking, talking, doing whatever you're doing. Well, we take an average of about 14 to 16 breaths per minute unconsciously. We don't even think about it. And the average human takes about 20,000 breaths per day. That's a lot of breathing in a day. 24 hours. It just keeps going. Never stops. Don't even have to think about it. Okay? Now, when we have irregular breathing, there's a lot of reasons why we have irregular breathing. We're going to look at all the different patterns of how emotions and breath are predictable and how you can actually take the emotion that's being demonstrated, whether it's a pain response, whether it be anxiety, whether it be insomnia, whether it be low-grade chronic depression or stress, and how you don't have to always treat the mindset first. You can treat the breathing and create a different patterned looping into the autonomic nervous system and retrain the person by retraining their breathing. Okay? So when we are looking at breath, we look at how it establishes a connection to our unconscious, to our conscious. Because like I said, most people aren't conscious of how they're breathing. They kind of take it for granted, you know, and they just breathe. Now, when we look at emotional and mental patterns, a lot of times we're in that mindset of wanting to change, wanting to improve, but it's a lot more work to change the thinking behind the emotion. Because sometimes the emotion is just this old relic. It's like just something you've done for a long time. It's your habituation of action and thinking and patterning. And a lot of times people will say, but I want to change that emotional patterning. And so what happens? They're like in a psychotherapist's office for a year, you know, and that's good. People need counseling. Okay? They do.
Yeah.
You know, it's an important thing, whether it be a confidant, whether it be a best friend, or whether it be a professional. Because we need to get ourselves back to optimal mental, emotional balance in order to evolve. One of the reasons why pranayama is so important is because you can shortcut your personal evolution by changing your breathing. You can change the way you emotionally feel and react by tending to your breath pattern first. Okay? Rather than saying, I don't want to feel like this. I don't want to feel like this. Don't breathe like that. And the change in the thinking, the change in the response will change. Okay? So we'll really go into how that works. So, you know, we have breathing. We have organs that we need for breathing, right? We have our nose. Well, this can make a big difference how you're breathing. Do you have a busted nose, a crooked nose, a deviated septum, polyps in your sinuses, clogged up mucus, congestion, chronic sinusitis, chronic allergies? That will affect your breathing automatically, whether you like it or know it or not. So we have to look first at how the breath is moving and through the sinus regions. If we've got a lot of mucousy congestion, we need to take a look at the diet. We need to ask, did I have 3 beers at midnight? Now I have a mucus fountain face. Did I eat chocolate cake and candy and a bagel with cream cheese at 9 p.m. and that's why I woke up with boogers in my face and now I can't breathe well? I'm like this. That's going to affect your breathing pattern. And some people, that's their life. They wake up with this every day because they're eating horribly. And they don't realize that the 3 bananas at 5 p.m. caused this. So that's where we go back to our nutrition course. Other thing we need to realize is some people have genetically structured sinuses that they may not be able to get air in through one side versus the other, or maybe they've had their nose broken. That can really affect your breathing and your overall quality of life. I've known people who have had their deviated septum corrected and they're like, wow, I feel different. Literally, I breathe different. I feel emotionally different. I feel energetically different. Then we want to take a look at how we breathe through our mouth. Some people have issues like dry mouth or they have sensitive teeth. So whether you're a nose breather or a mouth breather, just be aware of it. We have issues with the throat. Do you have asthma? Do you have breathing problems? So, we have this whole system, which includes our lungs. And we need to realize that our lungs have multiple compartments. And most people kind of breathe shallow. And they're just using a portion of their lung capacity. But it's the deepest structures in the base and farthest distal aspects of the lungs where the oxygen exchange occurs in the alveoli. And so when we're taking small, shallow breaths, we're not getting our full prana. We need to get our full prana, or we're radiating at a smaller frequency in life. So pranayama, we know, is one of the limbs of yoga, right? And we've learned in other classes there's 8 limbs of yoga, depending on how you're practicing it. But if we're just looking at generic yoga, not generic in a downgrading way, but in a basic manner, and we're looking at Patanjali's Yoga Sutras or Ashtanga Yoga, the 8 limbs, not the practice necessarily. We know that we've got our yamas and niyamas, like don't be a jerk and be tidy with your body and your temple, right? And then we know we have asana. We're going to move it. We're going to have a nice, strong body. Morning, Catherine. So we keep our physical body in order. Well, that next step, that 4th step is pranayama. That's a whole limb of yoga. And it's not just enough to say, I breathe. No. Like, let's get that on tight lockdown on how we breathe. What is your pranayama practice? At first when we learn pranayama, it's, okay, I'm doing my yoga practice of physical something on my mat over here. And now I'm going to choose to do a pranayama practice, right? Well, eventually you want that practice to become your life, okay? Eventually you want to be mentally taking note on a regular basis. That person made me mad. Now I'm breathing like this. I don't want to feel this way. I'm going to change my breathing. Somebody just cut me off in traffic. My heart's beating fast. Look at how I'm breathing. That's okay. Okay. I can back out of this reaction much faster now because I've become aware of my breathing and I'm changing the pattern. Or I can't sleep well. There's too much on my mind. Or I'm in pain. Something's wrong. Change your breathing. The rest will follow. Okay? Really important concept in life. And I would say that when we're moving towards the more advanced levels of yoga and yogic practice, not physical, but moving more into the mental and conscious connections, Your temple must be infused properly with prana. Okay, so yes.
Question, so there's so many different types of breath techniques, just as there's so many different types of asana practices, if you will. And certain asana practices speak differently to different types of people's bodies.
Yes,
and
yes.
what have you. So would you say that it's the same thing with breath?
Absolutely.
You should try different types of breath techniques and see which ones come really comfortable and make you feel really good, and then you move with those?
Absolutely.
Okay.
Absolutely. As long as you know why it's being done and it's appropriate to the body type, placement, mindset, etc.
So some are going to feel much more natural to different people.
Some will feel more natural. Some will feel like a better fit for where that person is. But then sometimes the breath technique needs to change over time once they become in balance or oopsie, out of balance. Yeah, good. So when we look at the word pranayama, prana, we know, is a form of life force. Chi, ki, prana. The body, we know, gets prana from food. If you're eating pranic-rich food. We know that the body gets prana from what we drink. Soda is not prana-filled. Water, yes, you're going to get better quality prana depending on what you're breathing or drinking. But our quality of breath determines the amount of prana we're getting through that other layer of body. So if we go back to some of our basics, some of you have taken the class, some haven't, we have all the different koshas of our existence. So we have our annamaya kosha, our gross physical body. And that's what our food and our water is going to primarily bring us prana. But we need breath, obviously, to fuel this physical vehicle. If I don't breathe, I die, yeah? So the better you breathe, the more prana that's going to go to your physical body for usage, not just cardiovascular usage, but through the meridians, through the chakras, and through your subtle layers, because we know that our second layer or kosha is our pranamaya kosha. And that's moving outside of our body. And then moving into the manomaya kosha, the mind channels. That's no longer within the physical realm of the body. That's outside of the body. And the breath will be a direct effect on that manomaya kosha. And then we start getting into the vijnanamaya kosha, where you're in touch with your soul's consciousness at a higher rate. And then that anandamaya kosha, where you're like floating in the universe out here. And that's our goal in yoga, yeah? To be able to consciously connect or yoke to that divine existence outside of us. So prana is an essential step in getting there. Essential. If you're not practicing pranayama, begin immediately. So when we look at the word prana, we understand the word prana, and yama can be looked at in a couple different ways. Breath control or extension of breath. Breath control tends to make us think that we have to have a lockdown on it. You know, I'm going to control this breath. Whereas when we think of yama as an extension, it's an extension of our energy outward. And how are you extending that energy outward? Okay, so you can look at it a couple different ways. And we also have a lot of information on the types of breathing as far as whether it's metabolic or behavioral. Metabolic breathing, it's automatic, unconscious. I go night-night. I'm going to breathe all night long. It's just metabolic. If my metabolic physical status changes, let's say maybe I'm going into diabetic ketoacidosis or some sort of fancy metabolic disease process, or I have emphysema, or I'm in a higher altitude, my body is going to say, something's wrong, something's weird, something's off. You will breathe differently. I demand it. So sometimes when we have physiological issues happening, chemical metabolic problems changing, our breath will automatically change. But that's metabolic breathing, metabolic demand. When we look at behavioral breathing, we have control over that. And if you're not controlling your breath, your emotions are probably dictating your breath. And if your emotions are dictating your breath, that sends a feedback system and keeps reaffirming that emotion. Your breath keeps reaffirming that reaction. Oh, you're anxious, you breathe shallow? Yes, I agree. The limbic system agrees. Your autonomic system agrees. And you stay in that pattern because the thinking and the breathing match. So it keeps going in a vicious cycle. And you're like this, but I don't want to feel like that anymore. And you try to change the thinking, but the breathing is still there. The limbic system, we'll get into a little bit more, still is receiving the signal of fight, and panic. So until the breathing changes, the full patterning can't change. Okay, so I want to take a look at emotional breathing patterns. So when we are panicky, when we are anxious, even when we're in pain, we have short, fast, shallow breaths. So if you've ever been in pain, your initial pain response is, oh. If you're anxious, it's, I'm totally exaggerating, but it's short, fast, shallow. When we're in a chronic state of anxiety, and many people exist in a chronic state of low-grade anxiety. If you watch them closely, if you study their breathing, they little tiny breaths, you can barely see their chest moving. Or if they get excited, then it's really obvious. You can see the kind of breathing pattern. That will reaffirm the emotion that they are exuding, or maybe not even trying to have. So when people come to the hospital and, I don't know, they have a palm frond through their forearm, whatever it is.
That's an interesting, you must have seen that, because where would you have thought of that?
Right, I was like this, breathe. The first thing I do is I don't tell the patient, stop acting like that. Stop panicking. Like, that doesn't do any good. Quit your panic. You know, what are you going to do? Throw water on them? No, the first thing I do is I go like this. Watch me. Look at me. Breathe. No, not like that. Watch me. Inhale. Exhale. And then like this. And I go, I'm not going to stop this train of connection with you until you breathe with me. And they're like this. I go, keep going. And you know, they're prepping meds or whatever. I change their breathing first. Why do you think mothers who are expecting in certain communities, in this particular culture, we take Lamaze training, right? Something like that. You know, there's a lot of other different ways, but they will spend a lot of focus on breathing. And how are you going to prepare your breathing to endure this pain, which is on its way in 9 months? You have to have control over the breath, to have control over your mind in many, many ways. When we look at angry, if you watch an angry person, other than the telltale of the tightening of the body, the stiffening of the jaw, the stiffening of the arms, maybe the clenching of the fists, or not. Some people don't give away their emotions. They've learned. But watch the breath. It's like a bull's about to charge. If I see people breathing like that, I'm like, Houston, we have a problem. It's coming. So angry breath is long, forced breathing. Think of a bull. So when you're angry, watch your breathing. If you don't want to pop off all of a sudden, stop breathing that way. Immediately change the breath and you'll be like this. Not going there. Just not going there. Because the minute the breath pattern begins, it sends a signal to the deep brain. Buckle up. I'm mad. And then all the chain reaction within your physical and physiological body begins to respond. And then sometimes it becomes a runaway train. You are the conductor of your train. You decide how much fuel and coal you put into that engine. And you decide what speed that vehicle goes. You have the gas, the steer, and the brakes. Nobody else is running your system. And you must learn how to control your breath to fully control your system. Okay? Pain, shortened exhales. It looks a lot like panic and anxiety. It's when you're really in pain, that exhale patterning really changes. So the first thing I'll say is, I know you're in pain, but watch me. Go like this. Because when we start the pain breathing, everything tightens up and you get less prana to your actual body area that's in pain. So the pain compounds itself. Other things begin excreting in the body, epinephrine, norepinephrine, which then again reduces the blood flow to the area and changes the blood pressure and pulse. So the breath is important when in pain. Calm breathing, nice, slow, steady breaths. That's always my goal, calm breathing, or happy breathing. Happy breathing is long inhales, long exhales. Yeah, that's nice. Big breaths, nice, slow. If I don't feel happy and I need to feel a little more cheerier, I do happy breathing. That's not a pranayama technique we're going to learn. But mimic the breathing of happy. And smile, even if you're like this. Sad breathing. You know the sad breathers. Eeyore. Oh. Low, slow, shallow with big sighs here and there. Oh. When I see people breathe like that, I'll say sometimes, if I know them well, most of the time I just leave people alone. But if I see them Eeyore breathing, I'll say, are you sad? And they'll say, no, not at all. I go, your breathing pattern indicates you're physiologically sending a positive feedback system to your limbic brain that you're sad.
You're like,
and they're like, I go, just take a look at your breathing. You breathe like a sad person. And they're like, no, I don't want to be sad. Don't breathe like that then. Yeah. Sometimes the teenagers, they're like, oh.
Here. And 6-year-olds.
And 6-year-olds. And I'll just say change the breathing. The rest will follow. Okay. So we can decide what the breath technique is doing to the autonomic nervous system. We have the fight-flight reaction, and we have the rest and digest reaction. Well, depending on which one you're tapped into, you could have chronic digestion problems because you're always in the fight and flight reaction. Because when you're in the fight-flight reaction of chronic pain, chronic anxiety, chronic fear, etc., it shunts blood away from your essential digestive system. It says like this, it's about to go down. Something's wrong here. Oh my gosh. And everything goes to emergency system. Well, you kind of need the blood in the digestive system. And some people with chronic gastric issues, it's a fight-flight reaction. It starts in the mind. And Ayurveda fully understands how the breath, how the brain, how the mind directly affects digestion. So sometimes we'll say, okay, well, you need to change the way you think. That's not always easy. Let's start with change the way you breathe. And you can get really good results that way. But they have to do it every day. You can't just do some 5 minutes of pranayama once a week and think it's going to change. Like, that's lazy. That's not buying into the system of changing yourself. Like, seriously. People say, yes, I've been practicing my pranayama. I did it on Tuesday. I'm like, nah, that's half-ass. That's not enough. That's not enough to totally change your mental, emotional patterning system. Okay? So, let's take a look now. Let's move down into a little bit more science. Involuntary breathing patterns are controlled by the brain stem. Okay? What some people call the reptilian portion of the brain. You know, it's very basic functioning. It's the last thing to go before brain death. You know, some people in comas, they have no gag reflex, no blink reflex, but they still breathe. So it's the deepest structure of the brain that controls it, the medulla specifically. And it regulates and is regulated by oxygen levels in the body. So if you don't have enough oxygen in the body, it's going to automatically tell your deep brain, oh, something's wrong here. Change the breathing pattern. You'll see that with people who have emphysema or COPD. They can't not breathe the way they're breathing. They metabolically are being forced to breathe a certain way to get enough oxygen or expel enough CO2. So we have chemoreceptors in the aorta. I'll try to breeze through this a little bit, but you've got the science. So chemoreceptors in the aorta and the carotid arteries that monitor the oxygen within the human system. And depending on what those concentrations are, they have a feedback system to the respiratory system. So the brain says, well, let's control the breathing differently. It's a must. It's a survival mechanism. And when we have low oxygen levels, it triggers us to take deeper breaths. You know, sometimes you get that, that spontaneous big sigh and big breaths. Chances are your body is saying, hey, cough it up. Give me a little bit more oxygen here. Okay. We have chemoreceptors in the medulla that also control and monitor carbon dioxide. So we know we inhale oxygen. There it is. 21% is room air. So concentration in this room right now is 21% oxygen. If for some reason the amount of oxygen changes, we're going to breathe different. But also if the carbon dioxide, which is what we exhale other stuff, if that changes and carbon dioxide starts building up in the body, your breath is going to automatically change as well. Okay. Now, when we have higher CO2, or carbon dioxide, accumulating in the body for many different reasons, it can occur, you're going to take deeper breaths to expel it. Okay, so if you ever have that urge to take deeper breaths, do it. Just like we talked about if you took the Ayurvedic Lifestyles course, never suppress the natural innate urge to, we talked about sneezing, coughing, urinating, etc., to take deep breaths. Okay, whether you're exercising or not, if your body's saying, I need to change my breathing here, do it. Okay, don't suppress that. Your body needs it.
I've been farting ever since that class. I was farting.
Right.
I was in the supermarket. My daughter's like, Mom, I can't hold it in.
Not to support. Go.
Just keep walking.
Go. Just go.
I crop dust in the supermarket.
Oh no. So we also look at the hydrogen ions in the body. So whether or not we're acidic or not, and that will change the way you breathe too. Now, we want to take a little bit breakdown on the science, because I'm not all about just let's wear some pretty mala beads and do some yoga in here. I want you to know the science. And I don't go too far, but I go far enough that it's like, meh. Now, we have the central nervous system. All right. In the central nervous system, we have the brain, we have the spinal cord. We have the peripheral nervous system, which is the cranial nerves and all the spinal nerves that come out of the brain and the spinal cord. Now, in that peripheral nervous system, we have different types of nervous system categories. We have the somatic, we have the autonomic, we have the sympathetic, parasympathetic. So we'll look at this for a moment. Now, the somatic nervous system, we're looking at voluntary skeletal muscles and how it is controlled by the peripheral nervous system. So I know, for instance, the nerve that's coming out from in between the bone of my spine at lumbar 4 and 5 is traveling down my leg and controlling how my quad flexes, functions, and how this area of my body gets sensation and reaction of the deep tendon reflex of my knee. Like it's there. That's your somatic nervous system, or peripheral portion of the peripheral nervous system. Then we have a breakdown also of your autonomic nervous system. And your autonomic nervous system, you can think of it as it's automatic. Automatic. It's your involuntary reactions. So it's I don't have to go like this. Hey, stomach, digest for me. I don't have to think about it. It's just automatic. It happens. My breathing is automatic. Now we have sympathetic nervous system and we have parasympathetic nervous system that are two subdivisions of your autonomic nervous system. So your sympathetic nervous system is what is going to mobilize your entire system during activity or reaction. Here comes a dog, it's chasing you. Your autonomic nervous system is going to go, wow. Sympathetic nervous system has some sympathy for me. Something's going down, okay? And it's going to react automatically. So if you're about to get into an altercation, that sympathetic nervous system is going to say, Houston, we have some sort of stress out there. Kick in some epinephrine, norepinephrine, shunt the blood flow, and prepare for battle. Or running, one or the other. I'm not sure which we're going to do yet. That's up to you. But it's going to change everything in your body. Your blood pressure will change, your breath will change, your pulse will change, the blood flow will change. Then we have the parasympathetic nervous system that says, everybody chill now. Take a rest. Take a load off. Eat some food. Digest it. Go cuddle up. You're all good. Well, the problem is too much of our population function out of the sympathetic nervous system at an inappropriate level because of chronic stress. They wake up in the morning, they're like, oh, my alarm went off, what time is it? I gotta get going. And they're like in panic, fight, and flight from the minute they wake up. And then they go to work and they're worried about a board meeting, or they're worried about a this or a that, and then they're tripped out by traffic, and then they're upset because they forgot their lunch, and then they drink a quart of coffee because they're tired, because they didn't rest, because their autonomic nervous system kept them in a state of agitation during sleep, so they drink a bunch of coffee and a Red Bull, and then they're like on frizzle fry mode, and then they get home and they don't know why they feel like garbage. Because they've been operating too much in the sympathetic nervous system all day long. And they never had the appropriate balance of that parasympathetic nervous system to go like this. Yeah, let's take a load off here. Let's relax. Our society tends to put too much value on go, 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 go. Produce, produce, produce. Get it, get it, get it. And not enough balance on stop. Like, just stop for a moment. Stop for a day. How about a week? Where's your vacation time? Like, take that sick pay. Stop being so on the sympathetic nervous system that you end up dying from it. Because it restricts your chronic flow. All right, so when
Restricts what flow?
pranic flow, especially because it's constricting the blood flow to certain regions of the body. So we know the sympathetic nervous.
Question. Is
Yes.
it possible with parasympathetic to do excessive too?
Oh,
And
well,
could that cause? Could the outcome be like a reaction, health related?
no. It is better to lean farther
On
to
that side?
the parasympathetic nervous system,
'Cause I
but
think of, like,
without
long-term-
becoming like lazy or inattentive to the physical body. You can work out, you can get everything done and be productive while remaining in that parasympathetic nervous system. It's only the sympathetic nervous system that says something's wrong, and causes that reaction. And we want to move away from that as much as we can. When we're in traffic and somebody cuts us off, we don't want to jump into that sympathetic nervous system longer than necessary. Like heart starts going because you had to jerk the wheel. You're like, oh my gosh. I'll immediately say, thank you, sympathetic nervous system. You're dismissed now. Okay. Let's just bring that down 10 notches. And I always try to go back to the parasympathetic nervous system because it's better for digestion, better for thinking, better for focus, better for prana. And you can shortcut getting back there with your breath. Good question. Now, when we're working through the sympathetic nervous system, it's a rapid mobilization of energy upon stimulation to a situation. It produces epinephrine and norepinephrine. This is not something we want pumping through our body every day at all, or for long term. Some people it is. It increases the heart rate, increases respiration, increases the pulse, increases the blood pressure. We don't want that. We don't want to sit in that sympathetic nervous system agitation zone. It redirects the blood flow from the muscles to prepare them for contraction, whether it's fight or flight. It's shunting it away from the digestive system. That's not good. It's shunting it away from other organs, which is not good. It directs the adrenals to secrete cortisol. That's not good either. Chronic stress, cortisol levels going up will then start giving us belly fat that's not necessarily just because of some calories. It's due to stress. And this stress reaction causes inflammation in the body. We don't want chronic inflammation. We understand now that chronic inflammation is the base causative factor of diabetes, heart disease, and a whole plethora of health conditions. So when we're sitting in that sympathetic nervous system agitation, we're doing a whole host of disease manifesting potentials. When we flip over to the parasympathetic nervous system, our digestive enzymes increase, our gut gets better blood flow, our peristalsis improves. Peristalsis is the movement of the gastrointestinal system. Our muscles relax. We want the muscles relaxed. Even if we're working out, we want to work our muscles out in a way that is not under stress. It helps us release higher levels of endorphins. And we know that the endorphins are the feel-good neurotransmitters, not the freak-out neurotransmitters, not the depression, anxiety, pain neurotransmitters, but the I'm happier and at more peace. And we also understand that when the parasympathetic nervous system is functioning more optimally, or we're staying in the parasympathetic nervous system more, that it alters the function of our pituitary, thyroid, and endocrine axis of the body. So we become more balanced at the hormonal endocrine level, which is really important. I know some women or men will come to me for endocrine problems, glandular issues. And I'm like, breathing, we're gonna address that. and thinking, we're going to address that, because most people just want to take a pill, an herb. I'm done. See, I'm healed. Well, no. You have a whole plethora of lifestyle changes that have to occur as well. All right. So when we look at pranayama, what's it good for? It lowers the blood pressure. Why? Because we're flipping from that sympathetic to the parasympathetic. It doesn't always lower the blood pressure. What if you already have low blood pressure?
Yeah.
It balances and normalizes it. Heart rate, same thing. It balances and normalizes it. It will come down. So when we're in the sympathetic nervous system, we tend to find a higher pulse rate. When we're in the parasympathetic nervous system, we tend to see a lower pulse rate. It helps balance the hormones and neurotransmitters of the nervous system. We discussed all that pathophysiology. It helps balance the metabolism. We discussed that pathophysiology. Enhances digestion and reduces pain perception. Okay? So people who have injuries, pain, chronic pain, acute pain, watch how they breathe. I remember being laid out on the sidewalk with glass and fuel everywhere, with a broken arm and a broken hand and a broken face and a subluxated spine, and I was like sprawled out on the floor, and the paramedics came and they looked at me, and I was like, don't touch my arms, they're broken. And they were like, oh, ma'am, I don't think anything's broken. You don't seem to be in pain. And I was like, don't touch me. I am broken. And they were like, why is this woman so strangely calm? She's not reacting as if she's in pain. Because I knew to breathe. I was like, hey, the more I freak out with my breathing, the more pain I'm going to experience. So you can dramatically change your breath perception and pain perception. So patients who are at the hospital, if they are addicted or dependent or needing more narcotic or pain relief medication than I'm happy to see, if I say, 8 Norcos a day, we might want to cut that down. 6 Norcos a day, let's cut that down more. My ultimate goal is for them not to need such strong medication, if at all possible. And I'll tell them, okay, every day before you put that pain pill in your mouth, before you even open the bottle, you're going to do 5 minutes of this breath technique. And I've been able to successfully get patients off of massive amounts of narcotics who've been on those levels of narcotics for a decade, 20 years, just by teaching them how to breathe. Because then, if they're used to taking a pill 8 times a day for pain, now they're doing pranayama 8 times a day. And it starts sinking in. It's like a insidious infiltration of their entire system. And then they're like, yeah, see me? I'm breathing. You're like, yeah, do that forever now. So pranayama also helps balance our energy, our emotions, and our awareness. We become aware of our breath. We become aware of our emotions. We become aware of our breath. We're more aware of our responses and reactions. When we are working on our pranayama, we become more in control of our ability to have cognitive behavioral modifications. So if you've studied psychology, you understand cognitive behavioral therapy is a buzz topic term. It's a very well-proven, effective methodology. If you change your breath, you can create immediate cognitive changes. Immediate. So we also understand that emotional patterns are linked and stored to our breathing. So change the breath, change your entire life in some cases. We understand pranayama, it gets rid of the carbon dioxide, we talked about that, and the cellular waste, it's good for getting some oxygen in, we talked about that. It also helps clear stagnant air and or mucus and congestion from deep within the alveoli. So we breathe in, goes down through the bronchus, it goes through our lung fields, and at the very, very, very end of that chain are these little tiny itsy bitsy sacs called alveoli. And that's where the good oxygen exchange occurs. Well, if it's stagnant or mucousy, it tends to get trapped in those lower levels. So by breathing, we're clearing all that out. You know, you vacuum your carpet, yeah? You mop your floor, sometimes more often than not. Do you clean your lungs out? Who thinks about that? You gotta open it up, clear it out. After surgery at the hospital, why do so many people get pneumonia post-surgical? Because they're not breathing. You're in there like this. Here's your spirometer. Take 10 big deep breaths. Like you have to force them to do it. Or they get the complication of pneumonia. Because why? Because they're in pain. They're going like this. Excuse me, you just sawed my chest open and did open heart surgery. And they don't want to take a deep breath. They hurt. So you have to force them to do it. Well, in our daily activity, unless you're doing cardiovascular, running, weightlifting, huffing and puffing, doing exercise, you may not be opening and accessing those deeper layers. So people with asthma, pranayama is a must. People with emphysema, that's a must. Any respiratory problem, pranayama is a must.
What if you have COPD?
Pranayama is a must.
Okay. I just didn't know if there were any challenges with that.
There are.
Okay.
There are. So we understand that the pranayama is good for a lot. It helps also, we talked about bringing in prana to the body. And I will often talk about prana or breathing as connecting you to your spirit. Breathe spirit in. Breathe spirit out. We understand that breath work can help us come into that higher connection with our own higher spirit. Because when we're off in some stinking thinking and our breath is down the track with it, we're not connecting with spirit as much. When we put that stinking thinking away and we change our breath, we get more prana in. We radiate more. So we understand that, pranayama can be good for balancing the doshas. Vata, Pitta, Kapha, we'll delineate which is which. It's excellent for Ayurvedic practices, yogic practices, spiritual practices. Now, who went to church as a kid? Did they teach you pranayama in church? Not my church. I went to a lot of different churches. Guarantee the priests are doing pranayama. A lot of our population are just now realizing that this is something that everybody needs to be aware of. Everybody needs to do it. Okay? It's not something that only elite yogis do. It's not something that is, or it's not something that should be mystified or not given to every common human. Every human should be aware of how their breathing affects them. And we're not taught this in school. After class, imagine if you had learned all this in grade school, how it would have changed your life. Okay? So pranayama types, well, there's tons of pranayama types, and it depends on what vein of practice you're in. So you'll find in different sects of spirituality, the pranayama may differ. There's over 50 types of pranayama, at least, that are more or less better known. Okay? So we have basic abdominal breathing that we're going to cover and learn. That has to be established first and foremost. We're going to look at Nadi Shodhana, or alternate nostril breathing. We're going to look at and learn and practice Ujjayi breathing, which is really core fundamental to a lot of yogis and their yoga practice. We're going to learn the pathophysiology and the indications, contraindications, and reasoning for Shitali and Shitkari pranayama. We're going to look at, explore all the benefits and reasons why we would do Kapalbhati, as well as Simhasana, breath of fire, Bastrika, with and without arms, and what the emotional impact or difference is, and which is better, which is not, what are the cautions and contraindications, as well as Brahmari, Shitkari, I mentioned already, and Samvriti. So we're going to learn 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, at least 11 breaths by the end of the day. Why we do it, when we do it, when we shouldn't do it, when we should be careful how to do it, when you just, no, that is not the breath for you, stop that immediately. We're going to learn which ones, if applicable, help control or alter the doshas, Vata Pitta Kapha, or if they're more applicable to mental things like schizophrenia, OCD, panic, anxiety, insomnia. Now, this is not a yoga therapy class. That's a whole different regulatory thing. We're not learning these breath types to go out and medically treat people, although I think we have 3 people in the room with medical licenses that can and probably will, but that's separate. But if you're teaching these to friends and family, yoga peeps, yoga friends, yoga classes, make sure you have in your mind locked down indications, cautions, and contraindications. Okay. All right. So let's go ahead and take about a 10-15 minute break. It's 10:20 right now. Let's take a short